it's hard to say what the British people are going to do long term with the National Health Service. The problem is there's no political push against it. So the British people will defend the egalitarian aspect of the National Health Service regardless of the quality. So, and it's funny because they're always grumbling about the National Health Service, like they grumble about the weather, like there's nothing they could do about it, right? So they complain about the National Health Service, but then they say, but oh well, it's good that it's free, but of course it's rubbish. So, you know, and we have a quote in the film of an old dear we interviewed in the streets of Glasgow.
So tell me, what do you think of the National Health Service?
Rubbish.
And that's the common answer. A lot of people just tell you their anecdotes of their horrible experience with the National Health Service. And their only answer, which is, all we need is more money. You know, that's the solution. And so the political battles in the UK are between socialist parties arguing that we can administrate this whole thing better, basically bribing the electorate for more votes. And so it's just kind of like Social Security here. We will be better at, we'll protect your, you know, your entitlements. And so the problem with that is that, and Hannon talks about this in the film, is if you're going to go down this road, it's really hard to go the other way.
So be absolutely certain before you go down this road that this is what you want to do.
Because people become dependent. You know, you start to talk, you look at the entitlements now, try and get rid of Medicaid and Medicare and, you know, Social Security, even though they're bankrupt programs. How do you deal with actually removing them without causing a lot of harm? It's a huge political dilemma because so many people are now dependent upon it, and they're unfunded now because, well, of many reasons, but largely because they were essentially Ponzi schemes to begin with. So the National Health Service, the British people, who tend to be in many cases fairly positive people, they've got no economic knowledge of the alternative, and that's the problem. And that's part of the reason we made this film. We want people to understand that capitalism and the free market, true capitalism, benefits the poor and would substitute and replace in that socialist systems like the National Health Service or like Medicare and Medicaid and do a much better job. And the first beneficiary, the person who would benefit most from that, is the poor, because they would get access where when the socialists come in, you know, you find this in education, they don't improve access. They actually get a terrible service. The free market is always the approach to bring the best, most affordable service at the lowest price. So that's what we're at. That's why we're strongly defending free market healthcare.